Hi, everyone. Welcome to this opening remark on catalyzing human dignity in a post-pandemic world. So during this presentation, you will hear Dr. Zephania Matanga. Dr. Zephania Matanga is a representative of the Canadian Multicultural Disability Centre. He holds a doctorate in the area of special education from the Department of Applied Psychology at the Ontario Institute for Study in Education, University of Toronto. In addition, he is a certified teacher in Ontario and Manitoba. He came from Zimbabwe in 1992 with a wealth of experience and first-hand knowledge about the debilitating effects of disability on professionals in his homeland and throughout Africa. His postgraduate studies in Canada and abroad are extensive. As a special education research leader, he has developed educational strategies that are most effective for children, youth, and adults with disabilities, non-speaking students, and those with seizure disorders, students with emotional behavior disorders, and those with visual disabilities and other physical perceptual disabilities. So we are very pleased today to introduce him and to hear him for this presentation that will be about 20 minutes. So Dr. Zafania, the floor is yours.
Thank you very much, Andrian, for giving me this opportunity to provide a keynote for the Spur Change Conference 2021. And I'm actually honored and delighted to make this presentation. And the topic for my presentation is empowering you, why equal access to education matters to persons with disabilities during the COVID-19 pandemic. And the reason for talking about education during the pandemic is very essential. Because when the pandemic COVID-19 hit the world, it affected many services. But one of the most hit services was access to education. Schools were closed, universities were closed, colleges were closed, all those things were closed. And those things are essential, and especially to persons with disabilities. During normal times, persons with disabilities have hard time in accessing education. And later on, when such a calamity hit not only one country, but many countries, so it is important to try and understand the impact of what it will have on people with disability and their dignity. So in order to understand, we should first find out what does education does to an individual, even under normal time. Education can be a powerful equalizer, integrator, transformer. It can actually transform and improve the quality of lives of people with disabilities and those with literacy challenges. It can help integrate them fully into society and make them equal and empowered members of society. So this aspect was hit hard by the pandemic. Access to education, access to services for persons with disabilities with devastating impact on their quality of lives and dignity. Whenever a pandemic takes place, a calamity takes place, it could be in conflict, whatever conflict takes place, one of the enduring results of any calamity is the creation of disability populations. Not only does that, it also has an impact on how the families actually deal with people with disabilities. People with disabilities will be more vulnerable, abandoned during these difficult times. So, as I indicated before, even though there's been major initiatives undertaken in the education field, advanced policies enacted and implemented, access to education is still a daunting task for persons with disabilities, and even worse so under the pandemic situation. So now I'll now talk from my experience of how a pandemic can affect an individual. Because all what we have is statistics. Oh, there have been so many people who have been affected with COVID. There have been so many people who have died. But underneath these statistics, we have individual stories, which is also forgotten. And those individual stories, sometimes they might turn out okay. Sometimes some people might die and never heard from them. We always have localized pandemic in some situations. And we always try to learn from them. In the village where I was born, in Zimbabwe, in the mid-60s, there was a pandemic. In this village, as you can see the hut there, that's where I was born. In a hut, there was no doctor, there was no nurse, there were only old women there. That's where I was born. Can you imagine if something had gone wrong, loss of blood, everything, but things just happened. And these are really celebrated women who are still doing those work in some parts of Africa and other worlds today, delivering their children on their own without any much support. During the 1960s there, the village where I was born, it was afflicted by a pandemic, although that pandemic was localized. The children in this village were attacked by measles, polio. A lot of them died. At the age of about 5, myself, I was afflicted by measles. When I was afflicted by measles, it was hard hit. And when I was hard hit, it affected my eyes. And the story is too long. I'll not go through it. But eventually, I got blind, taken to the hospital about 200 kilometers away. But what happened in this area, the stories were so many. You know, when a pandemic, the advent of pandemic brings about a lot of religious interpretations, political interpretations, myth, theories. As we also saw in the pandemic, we've seen people blaming other people for this and that. It also happened in this village. Some people did not believe that their children should be immunized. Some people did not believe. Some people came up with all sorts of the origin of the disease and who did it. And those things have an impact on people. So a lot of kids in this village were not immunized, some because there were no facilities. But some parents deliberately did not want their kids to be immunized for so many reasons, which I'll not go to. But I just want to highlight that those things happen, and they always happen, and it has an impact on individuals. But regardless, then, how we react to a pandemic is what is important. What will be the outcome for the pandemic for the world when we look at how we're going to help people with disabilities? As a person with a disability, although my parents were not highly educated, they were just peasants in the rural area in Zimbabwe. After I became blind, they didn't decide to disown me. They didn't decide for me to be just thrown out. As many children, what happened to many disabled children in this village. They decided that the only way I was going to rehabilitate myself and conquer this pandemic was to be taken to a school. So that's why I was taken to a school, which was about 400 kilometers away from my home in a place called Guero in the middle of Zimbabwe. At that time, when my parents took me there at the age of 6, I was really, really angry. because I didn't know why they were doing that. They they helped me, enrolled me in that school, and ensured that to receive the education. And why was I taken to this school? Because in the rural schools, there were no facilities for the visually handicapped people. There were no Braille, like you can see I'm reading Braille. There were no schools which would help me to read Braille and learn this, because when you are visually handicapped, the only way you can access education is reading this kind access to you. I cannot read print, I cannot see all those things. So the only way I'm gonna learn is through tactical means and auditory means. So I've been to be sent to a residential school for those kind of for me to be using those skill sets. At the beginning, I didn't like my parents at all, because most of my brothers and sisters were going to the local schools. So I thought in my mind, my parents had just dumped me somewhere, and they didn't like me. And I remember when I was going to this school, I would cry and cry, but the school headmaster would just tell my father, "Go home, don't worry about it. He'll keep quiet. He'll be okay after this." Not knowing that my father was actually giving me the most important thing in which will go a long way to help me in my life, which will transform me. As a result of that, I went to a school and got highly educated, went to the university. You can see my mother and father there, um, getting my first degree from the University of Zimbabwe in the late 80s. It was through that hard work, and I spent almost the entire primary, secondary school, and university far away from my home, with very little interaction with my siblings, which turned out to be good, but I was still in touch with them anyway. When I finished and got an opportunity to come to Canada in the 90s to do my postgraduate, I thought I had already been out of this village. I would have nothing to do with this village. When my mother died, I went in as customary in our culture. I went back home to go and participate in the burial ceremony of my mother. When I was there, many people from my village came to me asking if I could help them, because they just assume if you're in Canada or abroad, you might have access to these resources. I found it very scary. Said, when these people are coming to me, where can I get the help to help these people? So initially, I was very reluctant to see how I can build, because I didn't think I had the means to do so. So when I came back to Canada, I approached developing agents, one of the most well-known developing agents called the Manitoba Council of International Cooperation. And I brought them to the attention of the plight of the people where I was born, and told them my story, how I had been a part of the pandemic, which had made many people disabled in this particular area. Through Manitoba Council for International Cooperation, they decided to assist this area by building a school. And now we have just built a clinic. Now, instead of the kids being born in a hut just with no nurses and so forth, just like what I did, now they'll be delivered in those good facilities. You can see in the pictures there. So this is an interesting story out of the pandemic, which although it was localized. And we are looking forward that we shouldn't give hope. After the COVID-19, there will be great stories which we must follow. And this is what development agents should aim for. In the midst of this calamity, good things will come out, just like what we did with the help of the Manitoba Council, building school and building a clinic in this village here. And children used to go, even when there were still schools around, but they were walking distance and distances. with girls sometimes being raped when they are going to school and that kind of stuff. But now we have been able to build a school, and we are also in the process of completing a clinic in this area, in which will minimize the challenges as affected by the people, and it will also make sure that persons with disabilities will not feel bad about their parents, so that they won't be schooled far away from home. But if there are any parents in this particular people with disabilities, they will be schooled there. And we hope once this is done, we are going to produce a module and an idea of how less expensive, universally built schools can be produced not only in these villages, but in many villages in the parts of the world. So we worked with the community, we worked with all these people to produce these good facilities. So this can be done not in a very expensive way, but in an expensive way, but with the far-reaching results. So that was the outcome of the 1965 pandemic in Zimbabwe. My story. When we are studying, I'll come back now to how we look at disability from the scholarly work. Disability, the onset of disability brings a lot of things to people's mind. When you are meeting a person with disability, he could be having Down syndrome, you could be having all those things. There are so many means of how we interpret disability. Religious, if you see if you see in some religious reading, disability can be associated with the demoniac, especially if you have mental health. Disability, there are so many interpretations about what the onset of the disability. Some of them are very, very, if you listen to what people think about people with disability, especially in some parts of the world, you'll be surprised. So in an effort to try and understand how disability works, how we can interpret it, in the studies, we have 5 models which we always look at. We have what we call the medical model, the psychological model, the rehabilitation model, the social, the special education model, the charity model. So this is what the scholars have come up in order to deconstruct the myth and fallacies about what people think about disability. They've tried to come up with a way of thinking, with a paradigm shift. When we are talking of the medical, whenever you onset of disability, like what my parents realized when I became with measles, the first person they conduct is a doctor, is a healthcare practitioner. In the medical model, how the medical practitioners interact and work with a person with a disability, which is the first call for profession, is very essential. If you study at the issues of euthanasia and eugenics, you have seen that some people, even in the scholarly, you have always say, oh, the people with disability should be killed, they should be done away, their abortion should be taken, all those things. So medical professionals had also contributed significantly to the dehumanization of persons with disability through euthanasia, through eugenics, and other and many other things. So in the medical field, they are trying to understand the anatomical structure of the body, how it operates, and how it affects your impact of life, your quality of life. And as a result, they have deemed that person cannot operate, cannot function. The only way to do is just to dispense him. And this has happened for a long time in the field of medicine. Now, the psychological model is an attempt to try to understand how does the behavior of a person with disabilities, when it comes, when the disability is now permanent, it cannot be cured. You cannot use medical intervention. So we will now have to use psychological. How do we do this to try and solve the problem? Equally with the rehabilitation model, it also extends to special education model. And finally, the charity model. We have seen a lot of people with disabilities seen as object of charity. In some countries, people with disabilities spend most of their time begging in the streets. Just when you are a charity, when you're an object of charity, you have no rights. You just depend on the mess of the people. So your dignity is actually doesn't exist. So charity ensures that people's disabilities are objectified, they become objects of pity. So they are not supposed to ask for rights, they just have to depend on the mercy of the society. And we have seen this happening in many countries, and in North America and also in Africa. So now let's go back and understand what disability is actually, so that this is the most important aspect. When a person is a disability, what is it which has happened? In my understanding, there is nobody called disability. A person develops some impairment. So an impairment, it just means this thing cannot function. Your leg cannot function. Your eyes cannot see. Your brain has some impairment. It is just an anatomical behavior of the biological body. It has nothing to do with the demonic, it has nothing to do with all those things. But just having an impairment does not mean you cannot do things. What it just means is, now we have to interpret that impairment and put it in a situation. So in my understanding, that's what all impairment is. So now, what is disability? Disability is what is caused by the impairment for an individual not to be able to perform certain tasks. For example, I cannot read using print. I cannot see print. So as a consequence, I cannot see those things. So in that area, I have been disabled to see those things by the impairment. But this is what the impairment does. It doesn't mean that I've been disabled in any aspects. It's just that aspect which I've been disabled. That's when disability comes. So in order to overcome that disability, then we have to come up with other means to try and bring about changes. And that's what we call to exclusion. So exclusion is a process by which the physical, the attitudinal barriers is the responsible for creating the disability. So most of the disability does not come from the impaired individual, but it comes from the people around. It comes from the surroundings. It comes from all these things. That's where the disability comes. So it comes in the form of exclusion. So that's where disability comes. Disability does not come from a person with an impairment. It comes from the environment, which is not conducive, from the attitudes, which stereotypes people with disabilities. Those are the disabilities. So in try to overcome those disabilities, we have seen a lot of laws enacted, both at the state level, and we have now what is called United Nations Protection of Persons with Disabilities Act. All these are instruments which are intended to try and remove the disability. So disability is something that we can overcome, is something that we should be able to conquer. So as the pandemic ensues, they should come in such a way. Now we are confronted with this problem. How are we going to assist these people with impairment to overcome the pandemic? People are now spending most of their time with their families in trying to avoid being afflicted by COVID. As a result, we should empower the families. We should try and help the families, bring the resources among the families so that people with disabilities can continue to be supported. This will require a new paradigm shift of having resource being centered in the school, but to try and create resource and individualized resource based. Some people might think this is very expensive, but you'll discover that in the long run, this will be the most inexpensive way when we have family support, empowered support to support persons with disabilities, particularly during this time of COVID. So I will briefly talk about this, the gaps that exist between access of people with disabilities and the system. So one of the things is we have little input of persons with disabilities into curriculum and educational enhancement. What it means is, in developing all our systems, we need to incorporate the thinking of people with disabilities. You can develop all these big laws, but if the people who are impacted are not part of that, it's not going to work. Nothing about us will not help us. We need to incorporate and assist people with disabilities to participate in all systems that impact them. And that's how we're going to learn from them and how we're going to help effective strategies to overcome marginalization. And that's how we're going to develop effective strategies in order to make sure dehumanization does not take place. So to hear from them, to understand them, to hear their stories, to hear their experiences is a critical aspect of understanding. So in whatever we do, I can give you an example. Manitoba Council for International Cooperation emphasizes that if you are doing development, you have to make sure the people from the South participate in the implementation of those programs. That's how they are very successful. That's an indicator that whenever you are involving people with disabilities, you have to participate with them so that they can be part of the development. What you need is to ensure you have their narratives. Yeah. Beginning working with the groups, unless we are aware of our own values and the assumptions that hold us from learning about other people's experiences. So if you interact with a person with disabilities, you are actually learning, because it will be challenging your assumptions that a person with ability will do this is how we behave in that way. Thus, you are challenging your assumptions. So when you are interacting with the people from the South and from people whom we have little knowledge about, it's not about them. It's about your only disabling condition, which is disallowing you to understand those individuals. So the disability sometimes is not in the individual who is disability, but the disability is in the person who is thinking this person is disabilities. So when we are marching towards understanding what we call a nested process of inclusion, to understand inclusion is a nested process. Family, neighborhood, ethnic community. These are all essential aspects of understanding human beings. You have to understand as a holistic approach what happens at the family level, what happens in the neighborhood, ethnic community. So we should be able also to investigate ways people with disabilities are multifaceted individuals whose life circumstances are made up of a variety of experiences. So understanding people with disabilities in light of all of the forces that impact on their lives. Looking only at disability limits a person's identity and it does little to help us understand how a person's ethnicity, gender, class, religion play a role in their identity. So when we are trying to understand people with disabilities, we have to understand them in the holistic way of how they operate. They are not like objects, they have feelings, they can think. So how we interact them is very important. So in Canada, we have made major progress, although we still have a long way. We have the Canadian Charter of Rights and Freedoms. That's very important. And in Manitoba here, we've also made major progress. We have Manitoba Bill 13, the amendment to the Public Schools Act. We have also the United Nations Convention on the Rights of the Persons with Disabilities. These instruments are very important and essential because they provide a framework of how the people with disabilities can access services, and their rights now are enshrined in the laws, and then that's how normalization begins. That's how we begin to understand valorization and dignity. That's what disability people with disability have achieved and accomplished for many years. So the way forward now, especially in your developing in the developing community, when you are developing or providing services to people in the South, you should come up with very important questions. As we are providing and supporting these projects, what is the role of the people with disabilities? What are they going to be supported with? What is your project trying to accomplish as it relates to people with disabilities? If you look at the questions, which MCIC does, which is very important, some projects might not be able to meet whatever this, but always awareness is very important. In whatever you do in terms of development, try to think, what would the people with disabilities say? What would they do? How would they also benefit from the projects which we are implementing? And how should also people with disabilities in Canada participate in shaping out and developing these development projects? Because learning from people with disabilities in Canada may, although the situation might be different, can also be useful to people in developing countries. So what we do is to try and bring exchange of ideas and see what works in Canada and also what works in other countries. It may not work exactly as it is, but having that idea and encouraging the input of people with disabilities and organizations with people with disability to participate in development projects, it will be critical to ensure that persons with disabilities are involved and to ensure that those people who are with people with disabilities receive accurate and up-to-date information. That is what I think this conference, at the end, participants should begin to think in their own mind. In all these things about development projects we are doing, yes, we know they are doing an they are playing an important role in alleviating poverty, in alleviating suffering, in overcoming calamities. But there is an essential element that in this development there are things which will be impacting people long after the calamity is gone, long after the pandemic is gone. The disabling conditions, some of them are going to be generated immediately, but some of them will come later. So that's what I think we should begin to think. The long-term impact of our projects on persons with disabilities. And we should educate our people that they should value people's abilities and make them part of the decision-making process. Thank you very much.
Thank you so much, Zafania, for sharing your powerful story and for being such a strong advocate for people with disability. I'm sure a lot of participants will learn from what you just shared. And thank you as well for bringing hope on what could happen next and what could emerge from this pandemic. So thank you. This was very powerful.